Okay, I'm Shauna, and this is Alex, and we had chapter 52, which was the nursing care of a family when a child has an unintentional injury. Um, for overview of anatomy and physiology, it is kind of dependent on the injury, which can vary from a lot of things, so there's not really one clear cut physiology to go over. However, we do have some facts for you, which include that the unintentional injuries in children are the highest cause of morbidity and mortality in the US. And the leading causes of these are burns, falls, drowning, poisoning, and motor vehicle accidents. And then for kids, the spleen and kidney are at heightened risk of injury because they're more exposed. They're not like underneath stuff internally as they are in adults. And then the neck and spine need to be monitored closely.
One thing that's really important to talk about, because burns are such a big issue with kids, it's important to remember it's not the rule of nines in kids. It varies depending on how old the kid is. From birth through 1 year old, the kid's head is going to be worth 19% of his body, and the palms are each going to be 1.5%. And then that just the percentage that the head takes up slowly decreases as the kid gets older, until they're up at 15 years old, and it's back down to 9%.
Okay, so next we have common disorders. And first is head trauma, which is the most common childhood injury. They're mostly minor, which will have no long-term effects, but they all can potentially be serious. The most common cause of a TBI, which is a traumatic brain injury, is falls, and then being struck in the head from various things such as balls, bats, rocks, skateboards, anything that kids play with, really. And then third is a motor vehicle accident. And then because head injuries can be serious, there needs to be immediate assessment and interventions.
So then, in addition to head trauma, another really big one is poisoning. That's over 1 million cases a year. 90% of these occur in the child's home, and it's usually something like a cosmetic product, some sort of household cleaner, foreign bodies like toys, or like chewing on the edge of a crib that might have lead paint on it. And then medications is also a big one. There's about 10,000 cases each year of children eating medication that they're not supposed to, and they have to be hospitalized for that. Some other ones are abdominal trauma, dental trauma, drowning. Drowning is also a really big one. Most infants, or most of these incidents occur in bathtubs, and a lot more happen in the summer because it's nice out. They're spending a lot of time by the pools. Bites are also a big one. And then athletic injuries, injuries to the extremities, and thermal injuries. And the thermal injuries can be either burns, frostbites. There's a variety of them. In our presentation, we're just going to talk about the burns that are caused by heat, not get into a lot of electrical or chemical burns.
Too many things.
Yes.
Okay, so then for assessment of the injuries, the main things to go over are the same as you would an adult, like do your ABCs. So for the respiratory system, you want to focus on the rate and quality of the respirations and the breath sounds. Make sure there's no wheezing or stridor or crackles, any of that thing, and that they're not cyanotic, so look for color in the patient. And then make sure, or check for oxygen hunger, which is looking at positioning to determine if the patient is struggling to breathe. And they might not be able to lay flat, or they may have restlessness. And then for cardiovascular, the color of the skin, so bruising and just overall color, any evident breathing, like irregularities, pulse rate, blood pressure, and feeling of apprehension from vascular pressure alterations. And then the nervous system, so level of consciousness, PERLA, bruising of the head or spine, sensory function, or diminished motor function rather. And yeah.
So that's kind of the overview of the assessment that you want to do when a patient comes in. Specifically with head injuries, you want to be really careful about being careful with the spine until you can rule out a spinal cord injury. They're going to either have a collar on, probably, if they came in from an ambulance, or else you got to make sure to maintain head stabilization. And then the neuro assessment is going to be really important in these kids too. And you need to do this frequently because that's going to be the quickest way to determine if they're having some intracranial pressure. That'll probably build if the head trauma is severe, and their level of consciousness and their neuro assessment is going to keep getting worse and worse. Vitals are also really important in this because if they have a decrease in pulse and respirations, as well as an increase in the pulse pressure, which is the difference between the systolic and the diastolic blood pressure, that's going to indicate that there's intracranial pressure building as well. If a child comes in with burns, again, you want to start assessing the ABCs. That's always going to be the main concern, no matter on what the patient comes in for. Then you're going to want to classify the burn and determine the area covered by the burn, and that goes back to the rule of nines that we talked about. It's different based on how old the kid is, and there's actually programs now on computers that can help the nurses and doctors do quick calculations to determine how much of the body is affected, so then you can start your fluids faster. If they come in with, one more thing about the burns, always assess the whole body, because third degree and fourth degree burns aren't going to hurt at all. So if they're just because the kid isn't complaining of a burn doesn't mean that he might not have another one on a different spot of the body. If they come in with poisoning, again, ABCs and level of consciousness, and then you're going to want to determine the child's age, weight, what was swallowed or taken, the route that it was taken. It can be swallowed, inhaled, how much exactly was taken. So you're going to want to ask whoever found the child or someone who was present at the time if there was like a completely empty pill bottle, or if the pill bottle was open and they were spilled all over the room, so you're not sure how many they took. Just try and get an estimate of it. That'll help with the treatment. And then the overall condition of the child. Again, looking at his level of consciousness, how is he acting? Just really look at the patient. Yeah.
Okay, so diagnostics and therapeutic techniques for head injury, you kind of just want to be aware that edema and bleeding can cause brain damage. So the intracranial pressure needs to be monitored, and that should be started right away. And then also imaging like CTs or MRIs to kind of determine the severity of the bleeding or injury or whatever it may be. And then a venous or arterial line should be started to administer IV meds to decrease the ICP. So, and then that med should be hypertonic IV fluid. And then also, if they do have cerebrospinal fluid draining out of their head, if they have like a skull fracture or other head injury, you want to keep them in semi-Fowler positions that it's able to drain, and just keep them under close observation. And again, watch their vital signs and the neurological status. For burns, there's a few different levels between minor, moderate, and severe. For minor, just apply cool water, give them an analgesic for pain, and then gauze bandage to prevent infection. Moderate, you want to keep the blisters intact, and bulky dressing with antibiotic ointment to promote healing and also just decrease the infection rate. And then if the blisters do rupture, they can be debrided. And then for severe, continue fluid therapy, systemic antibiotic therapy, pain management, and PT. And the goal for them is then to prevent disability and maintain their best,
level of functioning.
Yes, that's what I was looking for. And then skin grafts may also be necessary.
So then talking about poisoning, this varies so much based on what the kid swallows. or ingests.
Mhm.
If it's some sort of a caustic chemical, you're not going to give activated charcoal, and you're not going to try and make the child throw up, because that can cause more damage to the esophagus and the mouth and airway. You're going to want to, as soon as the child gets there, number one priority after the ABCs is going to be pain management, because the child's going to be in a lot of pain. You're going to want to give a strong pain reliever. The book noted that IV morphine is one of the best choices for that. Then you're going to want to get a chest x-ray to determine if any perforation occurred in the esophagus, because that could have gotten damaged pretty badly when the chemical went down, and especially if the chemical went back up. And another reason that we're not going to give the activated charcoal is because that can interfere with some other imaging. You're going to want to do a esophagoscopy or a laryngoscopy, and then those will also assess for damage in the airway, the esophagus, and then it can look at the lungs too. And then these patients, you're also going to want the vitals, and you're going to want to check those pretty frequently, especially looking at respirations and pulse oximeter, because those are going to start to decrease if edema happens, and that can close the airway. If the patient swallows iron, like iron supplements, you're going to want to give proton pump inhibitor, and that can decrease the GI pain. Deferomoxine can be given, and that'll help to excrete the iron. It'll bond and be able to be urinated out. And then it varies so much based on what the child eats or ingests, inhales, whatever. Yeah.
Okay, so for health promotion and risk management needs, again, these are all kind of accidental things, so kids will be kids, so they kind of just need to be educated and provided the tools necessary to know what they're doing. So, for instance, like biking and skating, rollerblading, always make sure they're wearing a helmet. Don't bike in the street until they're able to bike like appropriately for their age, or that they're watched when they're doing so. Install car seat properly and use every single time. Children under the height of 4 feet 9 inches need a booster seat. It doesn't matter how old or how much they weigh. Use window gates and guards to prevent from falls. Teach children proper way to cross the street and educate on traffic safety. They do this a lot in schools as well, but even before they go to school, this should be done. So that's all for head injury. And then for burns in the home, install smoke alarms on every floor and especially near all bedrooms. And those need to be tested every month with new batteries. And then implement a family escape plan. Never leave food unattended, that's cooking, and restrict children's use of cooking equipment like the microwave, oven, stove, whatever it be. Check the water heater temp. It should be lower than 120 degrees. And then store matches, lighters, or any flammable things in high places where they cannot reach. And then for poison, you want to keep toxic products and medication locked up, and have the number for poison control available just in case anything does happen. Even if they're acting normal, you just kind of want to call to make sure. And then call 911 if breathing issues occur or the child collapses. And always read labels carefully and double check the doses before giving medication. This is even more important in children than adults. And then dispose of medication and toxins appropriately and safely.
So cultural considerations surrounding unintentional injuries in children is pretty much the exact same as any other patient who comes into the hospital. You're going to want to determine if English is the primary language. If not, consider using an interpreter. And then you're going to assess the patient's culture and see if there might be any alternative pain management therapies that could be used. And then assessing for cultural norms with communication. This goes for talking to the children and for like the parents. Some cultures, as a male nurse, wouldn't be able to talk to a female, or the female couldn't respond to me. So that's something to keep in mind. And then you're going to want to gain verbal consent to make sure that you touch and assess the child.
So then for our client-centered care plan, we found one that focused on a child with a head injury. So we've kind of gone over a lot of these steps previously, but you basically want to maintain head and neck like control and keep it in neutral position, and like follow your ABCs. So assess the airway, listen to breathing, and then children with more severe head injury should always be on 100% oxygen therapy. So that's important to administer that. And then there's a Glasgow Coma Scale that's adapted for children. So you want to use that as an assessment tool for their neurological status. And then you would want to acquire an eyewitness report of the injury, if applicable, to kind of see like how and when the incident happened and if people saw it happen. You want to assess PERLA, part of the neuro assessment, and then you would get CT scans just to make sure that everything is looking okay inside where you can't see. And then you would assess on the outside for hematomas, cerebrospinal fluid, or other fractures. And then this could obviously be a pretty tough time for the child and the parents, so you'd want to provide emotional support to everyone involved and then continue to monitor vitals throughout.
Like we said, this is a very, very, very broad chapter. There's a lot of information in there, a lot of variety. We tried to touch on the highlights and the biggest parts. Hope you enjoyed our presentation. Thank you.